Morning everyone, Dr. Eric, your fitness physician and peptide doc here. Today I'm continuing on my series about peptides. I've been bouncing back and forth between hormones and peptides and everything health related. So today we're going to talk about another one of my favorites. Last time I talked about thymosin alpha, which is an amazing healing peptide with many uses. Today I'm going to talk about thymosin beta 4. Also has many awesome uses we've used quite successfully for some time. So similar to thymosin alpha 1, thymosin beta is of thymic origin. It's created in your thymic gland, and unfortunately as we age, levels of production of course decrease. So that both the thymosins, as our thymus involutes or shrinks away over time, we start losing less and less of this. So it's found in most cells, almost every cell in the body. It's a 43 amino acid sequence, and fortunately, as similar to thymosin alpha, we've learned how to replicate this in the lab, and several pharmacies that we work with make top-notch peptides that exactly mimic this. So it mimics this thymic origin peptide. One of the cool things about this one, it's similar to thymosin alpha and BPC, which I have talked about before. Very synergistic, plays well with many other peptides, and then useful and often used in conjunction with several of the other peptides for healing and for various things. I use it all the time with BPC and with thymosin alpha 1 for that matter. One of the principles behind it, how it works, is that it's an actin regulating protein. Actin, probably some people, whoever in the science world thinks hears of myosin and actin, and that those are components of muscle tissue, but actin is everywhere in the body. And one of my colleagues, Susan Turner, her analogy is that it's like it lays down the train tracks. And once those train tracks are laid down, all the different cells can come in to heal. So it allows other cells and other components of your body, other proteins and enzymes to come to the area that it's needed to do its work. So it regulates these actin subunits, and therefore when during injuries or illness and things of this nature, these proteins are upregulated. So it's especially important for wounds and injuries. Again, your body naturally upregulates this protein to allow healing cells and proteins to come in. So that's what the thymosin does. It basically kind of kickstarts this process, kind of gives it a boost, so to speak, and even makes it even more powerful. It really upregulates this to get those healing components in. So basically, it's all about healing tissue. It does many other things as well, but one of the main reasons we use it is that it heals tissue, heals wounds, heals tissue. As I mentioned, when you get an injury, a broken bone, a scar, a wound, a burn, obviously our body's going to try to heal it. It rushes those cells to the area. So this can potentiate that process. So it's involved with regeneration, remodeling, and of course protection of healed tissue. That's one of the things that it's useful for. So I'll talk about that in the next video, but basically I just wanted a real quick overview of how it works. So it lays down those tracks, allows tissue to come in. So that's part one. I want to keep this video short today, keep your attention span, so tune in for part two. And now I'm going to tell a bit more about how it's used and how we dose it, etc. So thanks.